Now, before we move on with the chapter Role of Government in Health, I would like to give you the remaining question answers, exercise D and E. So, question number D1. Why should the government look after public health? Answer. The Constitution of India advocates that the state shall endeavor to raise the level of nutrition and standard of living and to improve public health, but it is hardly available to the poor. The section discusses how the disadvantaged faces immense problem in keeping good health. Every citizen has a right to the basic amenities needed to keep good health. Good health comprises physical, mental, and spiritual well being. D2. Discuss the different ways through which the government can improve and provide healthcare for all. Answer. Different ways through which the government can take steps to provide health care for all. Number one, establishing public health care at zonal level. Number two, setting up low-cost government hospitals. Number three, health insurance for basic treatment. Number four, provision of clean drinking water and steps to check pollution. Number five, generic medicines at low prices should be provided. Number six, healthcare program and creating awareness. Number seven, mobile clinics should be encouraged more in rural areas. Coming to D3, how would you try to remain in good health? Answer, steps we can take. Instead of you will write we can take. Be physically active for 30 minutes most days of the week. Break this up into 3 10-minute sessions when pressed for time. Healthy movement may include walking, sports, dancing, yoga, running, or other activities you enjoy. Second jota, eat a well balanced, low fat diet with lots of fruits, vegetables, and whole grains. Choose a diet that's low in saturated fat and cholesterol and moderate in sugar, salt, and total fat. Number three, avoid injury by wearing seat belts and bike helmets, using smoke and carbon monoxide detectors in the home, and using street smarts when walking alone. Children, just a second. अगर ऐसे तीन बड़े की वो पूरी हो तो बता देंगे किस फर्स्ट टाइम लगे हुए I'll tell you. Oh, sorry, kids. Coming to the fourth question, D4. Describe the role of Anganwadis in healthcare. Answer. Anganwadi workers and helpers are the grassroots functionaries at village level for delivery of services under central and state government schemes. At present, Anganwadi workers are paid an honorarium of about rupees 1000. Helpers are paid at the rate of rupees 500. An insurance scheme called the Anganwadi Karyakarta Bima Yojana has been launched recently. What D5, what difference do you find between private and public health services? Answer. Private health care services are expensive. Better service is available at a higher cost. They are well equipped with modern machines and technologies. People with good earnings will be able to afford them. Public healthcare services are comparatively cheaper. They are available at a cheaper cost for everyone. That is the reason they are overcrowded and the services provided might take time to reach the people. At times, they lack proper equipments too, which leads to delay in service provided. Coming to E1, describe the story of Hakim Sheikh. Why did the state government reimburse the amount of money he had to spend at the private hospital for his treatment? Now, here this answer would be just the same as answer C2. You can see it. One day in the year 1992, now he will be Hakim Sheikh, accidentally fell off a running train and suffered massive injuries. He was rushed to the government hospital. After some 14 hours of running around, he could get medical treatment in a private hospital. This private hospital charged him heavily for his treatment. Hakim Sheikh was so upset and angry that he filed a case in the court. The court directed the state government to reimburse the amount of money Hakim Sheikh spent on his treatment at the private hospital. So please make sure this answer is just the same as C2. Coming to E2. What was the unique decision taken by Kerala government in 1996? What was its effect? Answer, please mark. In order to improve the healthcare facilities in Kerala, a program was undertaken by the state government in which 40% of the state fund was given to the panchayat in the year 1996. Now this is same as your C3 answer, but further you have to write in points. You will write effects. This is effect written here, which is not clear maybe. Effects. EFFECTS effects. Number one, the panchayat was given funds to provide better facilities to the villagers. Number two, food was made available to all the poor villagers. Number three, women upliftment programs were organized to help them become independent. Then leave all that, come to fourth, education was provided to the children. Number five, Anganwadis were launched. After that, you write result. It resulted in a huge success and the situation in the villages improved. One could see that the supply of clean and pure water was regular. Health centers started functioning properly. Schools enrolled more students. This is your E2. Coming to E3, the healthiest of all countries of Latin America is Costa Rica. Why? Answer, the healthiest of all countries of Latin America is Costa Rica. It was decided in the country's constitution not to have an army. After that, leave 2-3 lines. It decided to spend the amount that would be spent on the army on the needs of the public health and basic needs of the people of Costa Rica. Next, the government of Costa Rica provides potable water and looks after sanitation and nutrition of people. It also provides housing facilities. The government spends much on public health care and education. So you can see it has part of C4 answer plus added to it E3. Okay. Coming to E4, it is our basic right to get proper and timely treatment at government hospitals
Hey,
discussed.
अच्छा चलो पीछे
Who's this disobedient child? May I know who's this disobedient child who's not listening to me? Can't you keep your mics off? Okay, coming to E4, it is our basic right to get proper and timely treatment at government hospitals discussed. The answer is one of the salient features of the Indian Constitution is the effort to establish a welfare state. The preamble and the directive principles of state policy make it amply clear that our goal is a welfare and socialist state through democratic means. This means that the government is expected to work for the welfare of the people in the spheres of education, health, employment, basic infrastructure, etc. According to our constitution, it is the primary duty of the government to ensure the welfare of the people and provide health care facilities to all. The government must safeguard the right to life of all people. If a hospital cannot give timely medical treatment to a patient, it means the right to life is not being safeguarded. With this, we come to the end of all the question answers covered till now. Is this much clear to each one? Now, I just end this call